makes me very concerned. If we just turn our backs, not only is it the wrong thing to do morally, it's also really the wrong thing to do for our security and for our economy. One example of that, and I know you talked about tuberculosis already, but I was going to ask you, Dr. Schwartz, about malaria. You noted that your organizations work in Nigeria to combat malaria. Could you give us a sense of the global impacts of reducing U.S. support for anti-malarial programs and what that could mean?
Thank you very much, Senator. Like a tool, you asked about return on investment. I'll give you an exact number. We just spoke with a different funder after the most recent cuts to the Presidential Malaria Initiative in Nigeria. Our team had been responsible for what we call seasonal malaria chemoprophylaxis in, depending on the year, somewhere between 8 and 12 states throughout Nigeria. We work with the Nigerian Ministry of Health at the beginning of rainy season every year to make those plans. Since February, when the Presidential Malaria Initiative projects were cut, we have been discussing with other potential partners to continue that important work in Nigeria. We just last week spoke with another partner, and I'll give you an example of the state of Benue in Nigeria. For each of the children reached, about 70% of the global malaria deaths are under 5 years of age. So for each of the children reached in Benue State, it costs $1.09 to provide the intervention on an annualized basis. $1.09. I'm not sure if you're a mother. I'm a father. I would say that $1.09 for my son on an annualized basis is a pretty impressive return on investment to save that child's life.